Many precious moments in life are captured, if you think about it, simply by sound. This is a time in today's show to really listen up, because you might not realize how much you are missing from the world around you because of diminished hearing. Now, before we begin, is this a common sound in your life? You can hear that. That sound is a sign that you need help. Here with more is Dr. Julie Prutsman with the Sound Relief Hearing Center. And that sound, when I first heard it, I went, wow, are people really living with that? And what do you call it?
It's called tinnitus or tinnitus. Both pronunciations are correct, but it's ringing, buzzing, hissing, any sound like that that people hear in their ears or head. And
I just had to cover, you know, when I heard it again, that I just had to kind of cover my ears. And now we can hear it again, and it's just, it shrieks. Yeah. How many Americans are really affected by this?
It's estimated about 50 million Americans are suffering with some form of this.
Now, what causes this?
You know, usually it's overexposure to loud noises. That's the #1 cause, but it can be something simple like excessive earwax or an ear infection. A lot of people actually can attribute it to a stressful event. So, you know, the loss of a loved one, change in jobs, stress is a big trigger for tinnitus.
It's amazing what stress can do and things that you wouldn't think about. So how does a person then know? I mean, we heard that loud sound. Know if they need to seek help. Is that a first indicator?
It is. So if you hear that even temporarily and it goes away, that might just be normal. But if you do experience it, you should have your ears checked out. Come in and see me for a baseline hearing test. See if anything's going on that we should be concerned about.
Now, are people often told that there's no treatment for tinnitus?
They are. They're often told there's nothing they can do, there's no hope, and it's not true.
It's not, because you're here to help. 15 years of helping individuals improve their quality of life. Why did you decide to specialize in this? It's such a unique field and niche.
Well, I'm a third-generation audiologist, so my family has been in this field for a long time. And, you know, I was just really frustrated with not having anything other than hearing aids to offer my patients. And so I was really inspired by Dr. Paul Yastreboff. He is a really well-known scientist that developed tinnitus retraining therapy, and he really inspired me to do more.
Now, you brought in some examples for us of treatment options, 5 different ones.
Yes.
Now, kind of walk us through here and point. Do you want to start right over here?
Yes, let's start here.
So this right here.
Sure. So neuromonics tinnitus treatment has been around for a long time. I've been helping patients with neuromonics since about 2005. It's a music-based sound therapy. It's customized to what the sound is that the patient is hearing, and it's a music-based signal, so it's a very specific sound. It's worn for about 2 hours a day, and in 6 months, 90% of patients report a reduction by half in that annoying tinnitus sound. So neuromonics is, yes, a great option. A newer one, this is the Serenade by SoundCure. This just got FDA approval this year in 2012, and very similar in concept and theory, except for it's using S-tones, which are, again, matched to the person's tinnitus, and it really is a soothing, low-level signal that a patient would wear when it's bothering them. So they put this on and wear it, and same thing. Within a few months, we see significant reduction in the symptoms.
And it just calms
everything down. It just calms the whole nervous system down and really rewires the brain, because really the brain is where this is happening.
Amazing.
Yes, and then the inhibitor, this box is just showing us, it's a bone oscillated sound.
And you have
the device.
Okay, yeah, let me see that. You're holding the device.
Yes, this is the demo model. The actual model is a little prettier than this, but basically it goes on the mastoid bone and produces a very high frequency sound.
You can hear it.
You can hear it from there, right?
Yeah.
To cancel a patient's tinnitus. And for some people that will provide immediate temporary relief from the tinnitus. And so the inhibitor is a nice option to be able to see if it'll help someone.
Isn't that amazing to just see how technology over days, years, it's really advancing.
It is. And then the last, specific to tinnitus, this is the Widex Zen. It looks like a hearing aid, but it actually has a Zen program that are fractal tones, and they really provide relief and soothing sound for someone who has that annoying tinnitus signal, you know, all day long. And then traditional hearing aids.
Now I wanted to discuss that, because a lot of people think, I have a grandmother that went through this, and I remember my great-grandmother, the hearing aids used to be so big, and you can notice it it has changed.
Yeah.
I'm like, Grandma, no one knows.
Nope, I'm wearing one right now.
You are?
I am. So this is the size of a hearing aid. You didn't even know I was wearing it.
I didn't. Yeah,
so they're
hold that right
very,
there.
very tiny, very small. This one happens to be pink because it was Think Pink for October. But yes, you can see all
then
different
the rest
colors and
here.
sizes. Yes, and they do not have to be bulky and big. No one has to know you're wearing it. It's comfortable, it's lightweight, and they're compatible with Bluetooth today, so you can match it with your cell phone. They're awesome.
Now you have a great deal for our viewers today to come in and see you, even if they're thinking maybe I have tinnitus or not.
Right, so I'm offering a free tinnitus consultation to sit down, talk about the symptoms. What have you tried? What have you been told? What can maybe I offer that's different? And also a free in-office inhibitor treatment to see if this perhaps would help. So I'm offering that as well to the first 25 callers.
And you are so active in the community. You're always up to something. You're really trying to make a difference. Recently, the breast cancer awareness with October, which ended yesterday. I can't believe it.
I know, yes.
So how were you involved with that?
Well, we were able to raise over $3,000 for the Susan G. Komen Foundation for Breast Cancer Awareness and Research, and that was really powerful. We participated in the Race for the Cure and raised funds for that great cause, so we were proud of that.
And then give the gift of better hearing. I love that you're doing this, especially now for the holidays, for this month and through December. Explain that more for us.
Sure. So we want people to nominate someone they know. Maybe it's themselves, but maybe it's a family member, friend, someone they know, neighbor. So we want to nominate the person who deserves the gift of better hearing. Better hearing is such an amazing change in quality of life for the person. So to nominate, you just need to either go on our Facebook page, Sound Relief Hearing Center, to nominate the person why they deserve to win, or email us at thedoc@youreardoc.com, and we're going to choose a winner. We're going to have a panel of judges choose a winner by December 10th.
Oh, that's great.
Yes.
And I can imagine, you're saying this is such a growing field because we love to wear little things in our ears now, and they go right close and crank the music, and it's just, I assume, becoming a bigger and bigger problem.
It is. We can't avoid loud noise exposure. We live in a very loud world, but we can protect our ears with custom hearing protection. For $100, we could have a custom pair of hearing protection made for a person who, maybe just needs it for mowing the lawn.
Exactly.
Or going to a concert, or, all those things that we do that are so loud.
So I bet it's really fulfilling for you to have someone that comes in and is hearing those different sounds, and then all of a sudden, do you notice just how they're really hearing that world around them?
Yes.
What do they say?
It can change a person's entire personality. You just see them kind of relax and enjoy their family and friends and not be so distracted by tinnitus or distracted by having to strain to understand conversation when they're with their family and friends. And so it's a life changer. It really is.
Yeah. Now I've been saying tinnitus, which is also correct, isn't it?
Yes.
Okay, good.
Yes.
I looked it up. I'm like,
yes,
I know I'm right.
Tinnitus or tinnitus.
Very good.
I interchange them, yes.
Well, happy holidays.
You
And thanks for what
too.
you're doing.
Thank you
Hopefully
so
we'll see you
much.
back here. Yeah, this is
Yes.
great. Start hearing the world around you clearly. Sound Relief Hearing Center offers several customized sound therapies based on the type and degree of tinnitus you are experiencing. That's not so good. Dr. Julie will help guide you along the way with all that you need to know. And today, take advantage of her special, a free tinnitus consultation and inhibitor treatment for the first 25 callers. Here's that number, 720-344-7600. Also, you can learn more information online at youreardoc.com. Also, don't forget about Sound Relief Hearing Center's Give the Gift of Better Hearing event. That's going on right now through the month of December. You can nominate yourself or someone you know to win a pair of digital hearing aids before the holidays. Send in your email to thedoc@youreardoc.com. Once again, that's thedoc@youreardoc.com, or also on their Facebook page. This segment was paid for by Sound Relief Hearing Center.